Good morning. Happy Friday. Around 700,000 people have some type of knee replacement procedure every single year in the U.S., and that number continues to grow. And if you're having knee or hip issues, our next guest, orthopedic surgeon Dr. Bob Gerling, is here with some really great information for San Antonio. Good morning.
Good morning.
Good to see you. We were talking a little bit earlier just about the fact that I feel like so many people have knee and hip issues, and they're not necessarily older. Right? I mean, is it typically older people, or can anyone suffer?
No, absolutely. Hip and knee issues are very common earlier in life, especially as people are more active and they're doing more contact sports and they're kind of doing things earlier in life that involve hip and knee problems. And those can translate down the road into arthritis and more severe issues where they're not able to do all the things they want to be able to do.
And maybe surgery is the only option at that point, right?
Sure, and it's one of those things where hip and knee surgeries are considered an elective surgery, but if you talk to somebody in debilitating pain, they'll tell you there's nothing elective about it.
Yeah, they can't live their life unless they
Exactly.
have that. So Methodist Texan Hospital uses some cutting-edge technology, and it's the only hospital in the Methodist system that uses this. Tell us a little bit about it.
So we've just recently gotten the Mako robotics technology system for our hip and knee replacements. It's a great system that allows us to be more precise with how we do the surgery, putting the components in place so that way we can maximize how long they last, make sure they're in the appropriate alignments, that way they feel more like a normal joint.
Okay.
And it also allows us to do it through a smaller incision and be more consistent with where we're placing our implants, so that way we can make sure we get all the life out of them that a patient could expect.
Now, how long has this type of technology been around?
So the Mako system itself's been around for a little over 10 years. They've been still working on adding to the technology. Right now it's indicated for the partial knee, what you're looking at right now, as well as the total hip replacement. And then we will be rolling out with the total knee replacement in the spring here in town, which is the most common surgery that we do in terms of joint replacements.
And when you have to do that type of surgery, I would assume that having the absolute best technology makes all the difference when it comes to recovery.
Absolutely. And nowadays, as we're doing these in younger patients than what we have traditionally, it enables us to be more confident that we're going to be able to get the maximum amount of length out of a joint replacement. So instead of quoting people 10 years, 15 years, we don't really know how long they can last. We think about 1% per year needs a revision surgery, but if you know you're putting the best implants in, you're using the best technologies to make sure it's where you want it to be, we're going to give people the best shot at having a long-term good outcome.
And one more quick question. If we have some people watching right now, maybe they're suffering with some type of knee pain, hip pain, at what point is it bad enough where they should seek you, where they should come and see you?
Absolutely. I usually tell patients whenever I feel like it's the best time for them to have a joint replacement is when they really see that their quality of life is dropping off enough to where it's affecting the decisions they make, they're not doing the things they want to do, and they're no longer happy with where they are. There's a lot of non-operative treatments we try first, but once those aren't working anymore, that's when a joint replacement can be a fantastic option. All
right, well there you have it, you guys. If you would like more information or you would like to get in touch with one of the fabulous doctors, you can get the information at Methodist Texan Hospital. They're at 6700 IH10 West in Balcones Heights. You can call them 210-299-0240, or you can always go online to MethodistTexsanHospital.com. Dr. Gerling, thank you. Happy Friday.
Yeah, thank you. Thank you for having me.
All right, everyone. And don't